Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser-known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your life. Today, let's talk about feeling helpless and why motivation can be more than a nice phrase. It can become a practical medical and psychological tool when it is used correctly. When someone says, "I feel helpless," do not dismiss it. Do not say, "Just be positive." Do not say, "Other people have it worse." Look at what is really happening. A person may feel trapped, exhausted, overwhelmed, ashamed, or convinced that nothing they do will matter. Why does this happen? Because the brain is constantly learning from experience. If you try again and again and the result feels the same, your brain may start protecting you by reducing effort. It says, "Why spend energy if nothing changes?" That is not laziness. That is a nervous system trying to conserve resources. But here is the important part. The brain can also learn control again. Motivation is not only a feeling. Motivation is a process. It is the process of connecting an action with a reason, a reward, a value, or a sense of control. If you wait until motivation arrives like a visitor at the door, you may wait too long. Instead, build motivation through action. Start small. Make the action so small that your brain cannot argue with it. Ask yourself, what is one thing I can control in the next 5 minutes? Not this year, not your whole life, the next 5 minutes. This matters because helplessness often grows when life feels too large. Bills, illness, family conflict, grief, failure, loneliness, pain, and fear can all arrive at once. The mind then makes a global statement, "Nothing works." But usually, that statement is too broad. Look at the sentence carefully. Nothing works? Or this one thing has not worked yet. Nothing can change. Or this situation has not changed as fast as you need it. That difference matters. In psychology and neuroscience, helplessness has been studied for decades. One important lesson is that the sense of control changes behavior. When people believe their actions can affect outcomes, they are more likely to try, persist, seek help, and recover from setbacks. When they believe their actions do not matter, they may stop trying even when options exist. This is why motivation must be tied to control, not fantasy. Do this. Separate what you can control from what you cannot control. Write it down if you can. You may not control another person's choices. You may not control the pargnosis instantly. You may not control the past. But you may control whether you make the appointment, take the medication as prescribed, drink water, step outside, answer one message, clean one surface, or tell someone, "I am not doing well today." Small actions matter because they create evidence. Your brain does not fully trust slogans. It trusts repeated evidence. If you say, "I can do something," but never act, the brain remains doubtful. If you do one small action, then another, the brain begins to update the story. This is one reason behavioral activation is used in mental health care, especially for low mood and depression. The idea is simple but powerful. Action often comes before motivation, not after it. When mood drops, people withdraw. They stop moving, stop connecting, stop planning, stop doing things that once gave meaning. Then the lack of activity makes mood lower. A loop forms. How do you break the loop? Do not start with a giant life transformation. Start with scheduled action. Choose one activity that gives pleasure, connection, purpose, or mastery. Mastery means a small sense of "I did that." It could be showering, walking for 5 minutes, preparing a simple meal, paying one bill, stretching, sitting near sunlight, or calling a friend. Put it on the calendar. Treat it like medicine for the behavior system. Why can this help? Because movement changes input to the brain. Social contact changes input. Light changes input. Completing a task changes input. Your brain receives new data. I moved. I chose. I completed. Motivation can grow from that. Pay attention to your language. The helpless mind often speaks in permanent terms. Always, never, nothing, everyone, I can't. Challenge those words. Ask, is that fully true? Ask, what is the smallest exception? Ask, if a patient said this to me, what would I tell them? This is not pretending everything is fine. This is correcting distorted thinking when stress has made the mind too harsh. Motivation also improves when the goal is connected to identity and values. Do not only ask, what do I feel like doing? Ask, what kind of person do I want to practice being today? A caring parent? A healing patient? A reliable friend? A calmer version of yourself? Then choose one action that matches that identity. Look at the word practice. You do not have to become that person perfectly today. You practice. If you fall back, return. If you miss a day, restart. The goal is not perfection. The goal is direction. Now let's make motivation practical. Start with the body. Sleep, food, movement, pain, hormones, and medications can affect motivation. If someone has no energy, no focus, no hope, and no drive, do not assume it is only attitude. Ask, how is my sleep? Am I eating enough? Am I drinking too much alcohol? Am I using substances to cope? Could anemia, thyroid disease, chronic pain, pregnancy, postpartum changes, infection, medication side effects, or depression be contributing? If symptoms are persistent, severe, or affecting daily function, get professional evaluation. In the emergency department, we take safety seriously. If helplessness comes with thoughts of self-harm, wanting to die, hearing voices telling you to hurt yourself, feeling out of control, not being able to care for yourself, or feeling unsafe at home, seek urgent help now. Call emergency services, go to an emergency department, or contact a crisis line in your area. Do not wait for motivation in that moment. Use protection first. If you are taking antidepressants, sleep medicines, pain medicines, sedatives, stimulants, or medications for chronic disease, do not stop or change them on your own because you feel stuck. Talk to your clinician. Medication interactions, withdrawal, and medical conditions can worsen mood and energy if handled without guidance. Now, return to motivation. Use the 5-minute rule. Choose an action and commit to 5 minutes only. Why 5 minutes? Because helplessness makes the starting line feel like a wall. 5 minutes lowers the wall. Tell yourself, I do not need to finish. I only need to begin. After 5 minutes, you may stop. But often, once the body begins, the brain follows. Use environmental design. Do not rely on willpower alone. Put walking shoes near the door. Put medication where your clinician says it is safe and visible. Put your phone away during sleep hours. Place a glass of water beside your bed. Remove one barrier. Add one cue. Ask yourself, how can I make the helpful action easier to start? Use social motivation. Helplessness grows in isolation. Do not wait until you have perfect words. Send a simple message. I'm having a hard day. Can you check in on me? Tell one trusted person what you are trying to do. Ask them to walk with you, sit with you, or remind you of one task. Human connection can act like scaffolding while your own motivation is rebuilding. Use tracking carefully. Track actions, not just feelings. If you only track mood, you may feel defeated on bad days. Track the behavior. I walked. I ate breakfast. I called. I attended therapy. I rested without guilt. Over time, these marks become proof. Look at the proof. Let it speak louder than the helpless thought. Use rewards, but keep them healthy. After completing a task, pause and acknowledge it. Say, that counts. This may feel awkward, but the brain learns through reinforcement. Do not skip the acknowledgement. If you only notice what went wrong, the brain misses the reward signal. Motivation also needs meaning. Pain without meaning can feel unbearable. Effort without meaning becomes heavy. Ask, who benefits if I keep going? What future moment am I protecting? What value do I refuse to abandon? Maybe it is your children. Maybe it is your health. Maybe it is faith. Maybe it is dignity. Maybe it is the simple belief that your life deserves another chance to improve. But be careful, meaning should not become pressure. If you are exhausted, meaning maybe as small as, today I will stay alive, take my medicine, and eat something. That is enough for some days. Let's talk about failure. Many people lose motivation because they treat a setback as a verdict. They say, I failed again, so I am hopeless. No. A setback is information. Look at it like a clinician. What happened before it? Were you tired? Hungry? Alone? In pain? Did you set the goal too big? Did you lack support? Did the plan depend on someone else? Adjust the plan. Do not attack yourself. Ask better questions. Not, what is wrong with me? Ask, what made this hard? Not, why am I weak? Ask, what support is missing? Not, can I change my whole life? Ask, what is the next useful step? For example, if you feel helpless because your health is declining, motivation may begin with one appointment, one lab test, one question written down before seeing your doctor. If you feel helpless because of debt, motivation may begin with opening one envelope or calling one support service. If you feel helpless because of loneliness, motivation may begin with standing in a place where people are present, even before you are ready to talk. If you feel helpless because of grief, motivation may begin with breathing, eating, and allowing support without forcing yourself to move on. Motivation is not the opposite of pain. Motivation is movement with pain present. Here is a simple daily plan. In the morning, choose one body action, one environment action, and one connection action. Body action: drink water, stretch, walk, take prescribed medication, eat breakfast. Environment action: make the bed, wash dishes for 3 minutes, open curtains, prepare clothes. Connection action: send a message, attend a group, speak to a family member, schedule therapy. Keep it small enough to repeat. At night, review without judgment. Ask, what did I do that helped even 1%? What made helplessness stronger? What will I adjust tomorrow? This teaches your brain that your actions create feedback. Feedback creates learning. Learning creates agency. And remember, professional help is not a sign that motivation failed. Therapy, medical care, medication when appropriate, community support, spiritual support, and crisis services can all be part of rebuilding control. If low mood, anxiety, trauma symptoms, or hopelessness continue for more than a couple of weeks, or if they interfere with work, relationships, sleep, appetite, or safety, speak with a healthcare professional. So, if you feel helpless today, do not demand a heroic comeback from yourself. Start with one controllable action. Make it visible. Make it small. Repeat it. Let motivation grow from evidence, not pressure. Look at the next 5 minutes. Choose one action. Do it gently, but do it. You are not required to solve your whole life today. You are asked to take the next safe step, and if that step requires help, reach for help. Thank you for spending this time with me in Doctor's Corner. Take care of yourself, take care of each other, and I'll see you in the next topic.